Today, we're talking about tinnitus, that ringing, that buzzing, that sound in your ears that no one else can hear. For so many people, it's a journey that starts with pure frustration. But we're going to map out a path that leads from that frustration to a place of real understanding and, most importantly, management. Let's dive in. Does this sound familiar? For way too many people, this is the first piece of advice they get. Go and live with it, or there's nothing we can do. It feels so dismissive, so isolating. But I'm here to tell you that is absolutely not the end of the story, not even close. So before we can talk about managing it, we have to know what it is, right? The official definition calls it a subjective phantom perception of sound. Now, those are two really important words, subjective and phantom. It means the sound is absolutely real to you, but there's no outside source making it. So while it's technically happening in your head, it is not imaginary. It's a real neurophysiological event.
It's easy to feel like tinnitus is some kind of modern problem, a product of our loud, stressful world, but actually, it's been around for, well, forever. Looking at its history really helps us see it for what it is, a legitimate condition people have dealt with for millennia.
And the history is just incredible. We're talking about ancient Egypt, where some of the world's oldest medical texts talk about people complaining of noise in their ears. We see it described on ancient Assyrian clay tablets. In the 10th century, the famous Persian physician Avicenna wrote about it, and by the 18th century, doctors like Jean-Marc Gaspard Itard were studying it. This isn't new. We've been trying to figure this out for thousands of years. So, if it's not imaginary, but no one else can hear it, how do experts even begin to investigate it? Well, that brings us to how it's done today, the modern clinical evaluation. Professionals have a really smart, structured, four-step approach. It all starts with just talking, a detailed interview. Then comes a full hearing test. After that, they do a specific evaluation just for the tinnitus itself. And finally, they figure out what the patient really needs. It's a system designed to make an invisible problem visible, tangible. And this is how audiologists actually characterize that invisible sound. They can do a pitch match to find out exactly what frequency it is. Is it a high-pitched hiss or a low-pitched hum? They do a loudness match to see how intense it is. They can find the precise volume of an external sound needed to cover it up, and even test if another sound can make it go away, even just for a little while. The point is, your subjective sound can be measured objectively. Okay, so once the problem is understood and even measured, what's next? What can actually be done? This is where we get to the most hopeful part of all this, the modern toolkit for managing tinnitus. See, the modern way of thinking isn't about some single magic pill. It's about building a personalized toolkit. And inside that toolkit, you've got things like psychological approaches. We'll talk about cognitive behavioral therapy, different kinds of sound therapy, amplification with hearing aids, biofeedback, and even relaxation therapy. The whole goal is to find the right combination of tools that works for you. And the thinking on this has changed so dramatically. If you go back to the 70s, the big idea was masking, just cover it up, provide immediate relief by drowning out the tinnitus with some other sound. But by the 90s, the focus shifted to something much deeper with tinnitus retraining therapy. The goal wasn't just to cover the sound, but to change the brain's emotional reaction to it so that it just stops being a big deal. A really key tool for doing that is cognitive behavioral therapy, or CBT. You've probably heard of it. It's a type of therapy that's all about reducing the anxiety that gets tangled up with the tinnitus. It helps a person change their negative thought patterns and behaviors related to the sound. So how does that really work? Well, CBT helps you see and then break this vicious cycle. The tinnitus sound is the trigger. That trigger leads to negative thoughts like, oh no, this is never going to end, or this is driving me crazy. And of course, those thoughts create really powerful emotions, anxiety, fear, hopelessness. And guess what? Those feelings make you focus even more on the tinnitus, which starts the cycle all over again. CBT gives you the skills to interrupt that loop.
Now, here's another powerful tool you might not expect: hearing aids. They do so much more than just help you hear. By bringing in more of the sounds around you, they enrich your sound environment, which naturally makes the tinnitus less noticeable. Plus, when you're not straining to hear all the time, your stress and anxiety levels go down. And get this, over time, this can even lead to positive changes in your brain.
So, all these tools we've been talking about, CBT, sound therapy, amplification, they are all pointing toward one ultimate goal. It's a concept that is absolutely central to every modern tinnitus management plan. And that goal is habituation. Now let's be super clear about what this means. Habituation is the disappearance of your reaction to the sound. The tinnitus might still technically be there, but your brain learns to filter it out. It starts treating it like the hum of a refrigerator or the sound of your own breathing. It's just background noise that isn't important. And when that happens, the negative emotional baggage just fades away.
Sound therapy is one of the main ways to get to habituation. You can use complete masking, where you just crank up another sound to totally cover the tinnitus. That gives you immediate relief. But for long-term habituation, the preferred method is partial masking. This is where the therapy sound is set just low enough that your brain can still hear the tinnitus. By hearing both at the same time, your brain learns, oh, that tinnitus signal isn't a threat. I can ignore it.
This quote from Dr. Pavel Jastreboff, who is a true pioneer in this field, just sums it all up perfectly. It's a two-part process. You have to habituate to the sound itself, sure, but just as important, you have to habituate to the emotional